Hi, and thank you for watching this video. My name is Yuri Ivanov. I am the project manager for the Chronic Care Project for MIS 675. Before we begin and talk about our first progress report, I wanted to give a brief introduction to chronic care management and where it came from. Chronic care management was a program and initiative by the Centers of Medicare and Medicaid Services to bridge the gap for those persons with two or more chronic conditions. They saw that there was a great healthcare need that wasn't being addressed. If you are a person with two or more chronic conditions and you are waiting a year to 6 months between your doctor's appointments, a lot of things in that time can change. So they came up with this program, the Chronic Care Management Program. And our goal with this progress report and our eventual final project is that we can create a template that follows the structure that has been outlined by the regulations and rules that will provide great patient care, better patient outcomes, and will be hopefully something we can all be proud of. So without further ado, I will begin our PowerPoint presentation. All right, in our agenda, we will cover several things. We will cover an introduction, a progress report, our project charter, our scope statement, team contract, and schedule draft. The first thing is, what is a chronic disease? Well, CMS defines chronic disease as a condition that lasts at least one or more year and requires continuous medical attention. A chronic disease could be obesity, it could be hypertension, it could be diabetes. These are examples of common chronic conditions. Now, this is the healthcare costs, care spending as a percentage of GDP. And as you can see, it's been trending in the wrong direction for quite a long time. We're not just doing this because it is going to positively impact patient outcomes, but also because ultimately this is the change that we need to happen in our healthcare system. We need to start bridging the gap between patients and providers more and more before we could really take a dent into the cost of healthcare, which affects all of us. Our project timeline is outlined here. As you can see, we are at the midway point. Our great team members are myself, Yuri. I am the Director of Clinical Operations, Jasmine, and Terry, who are of excellent team and excellent contributions. So we will go through the progress report, the work completed. We have completed all the deliverables, including the work breakdown structure, statement of scope. We still have to complete a comprehensive care plan template. This is very important. This document is going to be necessary for any service provider, for those who are providing the chronic care management service, which is at least a 20-minute phone call. So to outline that is at least a 20-minute phone call to a patient with two or more chronic conditions. What's going well? Well, our team collaboration is great. We have a great team. What is not going well has been difficulty in us finding time to organize. Very busy schedules. We are making the most of it and planning to work more closely together. A suggestion we had is more meetings. Every time we have a meeting, our progress moves forward. We have a great team, and our different skill sets and viewpoints help to make our project come together. Project changes, more structure is always necessary, especially with avoiding mission creep, as there are quite a number of possibilities of what we can implement. Project charter, the budget. The budget is going to be largely determined by the staff manpower that we will need. Essentially, what happens is when this service is performed, a bill is sent to Medicare, and Medicare will then reimburse the physician. Now, exactly who should be performing the services? Will it be the provider? Will it be the nurse practitioner? Will it be a registered nurse? Or will it be a medical assistant? Is something that we have to analyze. Now, our success criteria is making sure that we create a program that follows the rules and regulations set forth by CMS, including being billable, and that it provides value to our patients. Now, before I go any further, I have to mention that we are a multi-specialty private practice. So for us, this is how we're able to achieve success and to even embark on this project, because we have a willing and excited, enthusiastic sponsor. So part of the planning stage was making sure that we could do this project in the first place. We want to see how well we can organize the necessary information. CMS has many guides, and we have followed them closely. And then setting in order exactly the process that we would like to have, and make sure that whatever process that we put together fits with CMS's regulations and guidelines. Now, on top of this, we have to create a model. I mentioned the comprehensive care plan before. This model has to be easy enough to follow for those persons who are providing care, and also the primary care or specialty providers who are going to be reading these plans. We propose a trial week. It could be even a trial month. But the most important thing is that we need to have a proof of concept. After this proof of concept, we will do a review. This review will talk to all the key stakeholders and see what their feedback is and adjust accordingly. And then once we have the feedback and have made our adjustments, the official implementation may begin. Project justification, of course, is that this is not just something that's going to be helpful to patients. This is something that potentially could help with the finances of a medical office, if done correctly and if properly structured. We have to ensure that the product user acceptance criteria meets all of the Medicare standards. One of the challenges and reasons why every practice does not do this program is because there are strict guidelines set forth by the government as to how the outreach will be done, by whom, and what must be achieved, and for what length of time it must be achieved. We have different project management related deliverables, including product related deliverables, a comprehensive care plan template, among them a financial analysis of the pros and cons of using different provider types, be it MA or nurse practitioner. Of course, we also have a team contract. Very important to us is the respect of all opinions and viewpoints. A diversity of opinions and viewpoints to us is strength. This is our draft schedule, which you can see more of on our Google site, which we encourage you to visit. And in summary, chronic care management, when it's done correctly, as we are aiming to do, it will not only help to improve patient outcomes, but it will also impact the local communities and the healthcare system as a whole. We're taking a step forward towards redefining what good healthcare is. Though we've faced challenges, our mutual respect and collaboration has helped us aim towards our ultimate goals. We have had a great productive session this first half, this first progress report, and we look forward to taking the successes that we've had here and moving them forward into the second half of this project. So thank you for your time, and we encourage you to inquire more about this project. This is certainly something that we are very excited about.